Hello guys, welcome back to my channel. My name is Monu and in this video I'm going to give you some insight about AMC, which stands for Australian Medical Council. I'll give you information on internship, PG and the ways that you can get job opportunities in Australia. Before we head on to the examination pattern and the subjects and so, I would like to start from basics here. That is, there are so many different ways that you can enter Australia apart from giving the examination, AMC part 1 and part 2. So the other ways will conclude it in two parts. The first one is for the fresh graduates, people who are in the final year of their med schools or those who have freshly graduated. The another one who are experienced, who have at least 1 to 2 years of clinical experience. So for the fresh graduates, we have further divided into two parts. People who have appeared for USMLE and PLAB, they have already cleared all the steps of these examinations and they are done with this part, and now they would like to move to Australia. Or in another case, if someone gave USMLE and PLAB but did not get a seat in the respective countries, so they can go for Australia. The second is for freshly graduated people, those who haven't appeared for any other examination and who would like to start from Australia. For PLAB and USMLE, they already will have an opportunity over the graduated ones. How? I'll explain you in the later half of the video. For now, we will talk about people who are going to graduate or who have just graduated. The first step will be to check college on Medical Board of Australia. Now, this is not just for Australian Medical Council. This is for anyone who want to appear for any medical examination all over the world. If you want to go for USMLE, please check your college for American Board. If you want to go to Australia, please check your college name in the list of Medical Board of Australia. This is the way you'll understand that your college is eligible. There are certain colleges that are exempted from certain parts of the world, like you cannot give USMLE from certain parts of Ukraine. Or if you have graduated from certain colleges in Ukraine. So for first part, check your college on Medical Board of Australia. I'll drop down the link in the description box for this board. You can go there and check. About VN Karazina in Ukraine, it is eligible, so there is no problem. If you are a graduate from VN Karazina, you can go to Australia. The second step is to register online for AMC portfolio. Now, what is AMC portfolio? It is a CV. Like, it is a collection of your documents, identities, your name and your identity, like your photo. It is an electronic portfolio which will cost you about $500. Whenever I'm going to talk about dollars in this video, please consider it as Australian dollars, not Canadian or American dollars. So 500 Australian dollars for AMC portfolio registration, which will be done online. The third step will be to register online for EPIC. Most of the people get confused between AMC and EPIC. EPIC is a part of AMC. EPIC stands for Electronic Portfolio of International Credentials. This is again similar to AMC, but this is like a more broadened up portfolio. You'll have an electronic portfolio of your credentials for all the international students, which will cost you about 120 Australian dollars. The fourth step is to register online for ECFMG. Now, this is similar for USMLE and for AMC. But for AMC, you have to register in three different council and three different portfolios. Once you are done with your ECFMG verification and registration, you'll send the copy of ECFMG to your AMC. After you are done with the registration stuff, the next step will be to give AMC step 1. There are two parts of this examination, part 1 and part 2, that I'll include in the later half of the video. For now, just remember that there are two parts and you need to give those two parts. There are about 12 months validity for this examination. You can like reschedule your examination, but once you have registered for the exam, you have to give it within 12 months. If not, then you're done with this examination. Seventh step would be to give to start internship. Now, there are two ways. Some people like to do in AMC part 1, then go for internship, and once you have known the Australian culture, like Australian healthcare system, it is easier to give AMC part 2 since it is clinical, but most of the people opt for AMC 1 and 2 together and then go for internship because it will give you more privilege, it will give you more validation to your portfolio. So doing AMC 1 and AMC 2 together, and at the earliest phase, like once you have graduated, do it ASAP, as soon as possible, so that your chances of getting accepted in this council, in this healthcare system, will be higher. So do AMC 1, AMC 2 together, then go for internship. You'll need a visa for that, which is an easier process as compared to the UK one. You'll have an internship of 1 year in Australia. Now keep in your head that you have to do this internship no matter what. No matter if you have done your internship in India, Ukraine, China, or anywhere around the world, you'll need to repeat the internship in Australia for 1 year. So if you are someone who is studying abroad and who is from India, what you can do is drop the MCI plan and directly go for internship in Australia. Prepare for MC 1 and 2 while you are studying abroad. This internship you will be paid about $40,000 to $60,000 per year, and this pay scale will continue for coming 3 years. Once you have done with your internship of 1 year, the 8th step would be to pre-vocational training residency post. This is just similar to the residency training of UK that you do after PLAB 1 and 2. This is normal residency training which lasts for 1 to 2 years. The 9th step is to registrarship for vocational training. You either call it registratorship or vocational training, which lasts for 3 to 6 years. You can also call it as your specialty training. Why 3 to 6 years? Because it depends upon which subject you are choosing, which specialization you are choosing. So in total, 1 year internship, 2 years of pre-vocational training, and 6 years of vocational training. It is going to be about 9 years. So 5 to 9 years depending upon the specialty. 5 years for specialties such as general practitioner, and 9 years for specialties such as optha, obs and gynae, and surgery. So keep these specialties in mind. Let's say if you are going to be a surgeon, be ready. You have to invest 9 years of your life for this specialty. The PLAB and USMLE part was, if you have appeared for these examinations and you already have some experience, let's say you did PLAB 1, PLAB 2, then you did some clinical training in UK, and you did MRCP part 1 and part 2. After you are done with MRCP, you do not need to give this examination. You can just enter Australian healthcare system directly. You do not need to go through this whole process. That is one point. Another point is there are 2 ways. One is specialist pathway, another one is competent authority pathway. But this is not for IMGs. IMGs stand for International Medical Graduate. So if you are an international medical graduate, you do not have an option to go through this pathway. This is only for Australians. The another one is specialist pathway, which is that you can go ahead with. That is that I told. If you are done with PLAB 1 and PLAB 2, you still need to give this examination. But if you are done with MRCP, you do not need to give this examination. Keep this in your head. PLAB 1 and PLAB 2, you still need to give this exam. You will get some privilege, obviously, but you will not get exempted from this examination. You have to give this. And for MRCP, you do not need to give this examination. Another one is for the experienced one, those who have gained clinical experience. What you'll do is you'll apply for fellowship of Royal Australian Colleges of General Practitioner here, online. And then you'll give an examination. If you will clear that exam, you'll get a RACGP fellowship. Fellowship is like your specialty training. So you'll go with that process. You'll not need to give AMC examination and all that if you are clinically experienced. Now for the examination for the freshly graduated people or who would like to go to Australia after PLAB and USMLE. This is an examination for internship or PG in Australia. There are 2 parts, part 1 and part 2. Part 1 is similar. Now the pattern of the examination are same. In USMLE, in PLAB, in AMC, like the first steps are MCQs and the second steps are clinical, that is doctor and patient interaction. For the first part, MCQ, it is an CAT examination, which stands for Computer Adaptive Test. That is, you'll give these MCQs on computer. The maximum score is 500 and the minimum passing score is 250. So you need to get about 50% in the exam to pass this. The exam costs you about 2,720 Australian dollars. If you want to verify your result, it will cost you another $75. If you want to cancel your examination, it will be $1,360. Result for step 1, result for part 1 comes after 4 weeks, and you can give this examination from all over the world. Like, there is a list of the places that you can appear from. I'll drop that link in the description box as well. There are about 2 to 3 places from each country that you can give this exam from. The second part is clinical examination. That is your patient to doctor interaction, and they'll check you on your interpersonal skills. It costs you about 3,530 Australian dollars. Retesting will cost you about $2,000. Like, because of some reasons you were not able to appear for part 1, and your 12-month your 12-month registration time is done, you can retest it for $2,000. Results will come in about 2 weeks. Results are posted on the website every Friday, 5 p.m. local standard time, local Australian time. This you can only give in Melbourne, so you'll have to travel to Australia to give this examination. But here the passing rate is a bit low. Like, according to the previous year statistics, from out of 2,100 participants, only 600 students passed this clinical examination. So the passing rate is a bit low. Another part is about subjects. Now, the difference between PLAB, USMLE and AMC. In PLAB and USMLE, you are tested on preclinical subjects as well. Like, in USMLE, both preclinical and clinical. In PLAB, more focus on clinicals. In AMC, only clinicals. So the subjects that are tested against are general practice, internal medicine, pediatrics, psychiatry, surgery, and obs and gyna. These are the 6 subjects that you will be tested upon. For the part 1 and part 2, if you want to appear for these exams in 2019, they will open the registration on 12th of November, coming soon, at 10 a.m. local standard time. So stay tuned. Go and regularly check the website for the application form and for the registration process. Now, some FAQs. The one that I received were, first thing, IELTS. Now, for PLAB, IELTS is a mandatory test, but for AMC it is not. If you just want to appear for AMC part 1 and part 2, you do not need to give IELTS. But once you are done with AMC part 1 and part 2, and you want to start your internship or job, you need your IELTS. So IELTS is not important for exam, but it is mandatory for internship and job. So what you can do is, you can do AMC part 1 and part 2, then give IELTS, and then appear for your internship. You must get a minimum of 7.0 bands in IELTS examination. Another thing here is OET, which is again a language test similar to IELTS, but most of the people have concluded that OET is a bit easier as compared to IELTS. OET, the minimum score you must get is B score. So keep that in your head. 7 bands in IELTS or B score in OET is valid. Third part is about books. Now, there are tons of material that are available online for both part 1 and part 2. But these are the one you can go through, like the most important ones. For part 1, that is the MCQ CAT test, AMC handbook. First, you'll go through handbook theoretical part. Then you'll practice some mock test. Or you can do it alongside. Like, you can read one topic from the theory part and you can do 50 questions of mock test. Third thing is application. You can download this app, that is CanadaQ Bank or Canada Q Bank. This is like the practice test question app for part 1. Also, the Bible for this examination is John Mutka General Practice Reference. This is like the Bible. Like First Aid for USMLE, 1700 for PLAB, and John Mutka for AMC. You must go through this book cover to cover. For second step, that is more interactive one, you must go through McLeod's Clinical. Now, this is the book that is often referred to for clinical subjects, even if you are not going for AMC. Another one is Oxford American Handbook. Both of these books are very, very good. If you are just a medical student of last years of your med school, you can just go through this clinical book, no matter if you are appearing for AMC or not. Very, very good handbooks. So this is it for this video. The last part before ending is about the sites. These are the two websites that you can check for further information. medhire.com.au, medhire.com.au. If you want to know about the job opportunities in Australia, like if you want to know about the certain specialization, let's say ophthalmology or surgery, you can go to this website and check about the job opportunities. Another one is melbournesurgery.com, melbournesurgeryincontinuation.com, and you can check about the materials on this website and about the process in detail. One more point was, during internship you get paid for about $40,000 to $60,000 a year, and this pay scale will remain up until your end of the training residency post. So for 3 years you'll get this pay scale, and then it will go higher and higher. That's the end of this video. So I would like to conclude this video in few short lines here. The current situation in the public hospitals in Australia, where there are increasing number of local medical graduates, they are looking for fixed number of positions. It will be increasingly hard for fresh AMCs to get hold of resident jobs in the cities or the regional centers. So there will be much more competition if you want to go for Australia. Whereas if you are going for your assembly and plab, there are more chances that you will get accepted. There are tons of local medical graduates in AMC in Australia that they don't need any foreign graduate, but if you are very good at something, you must go ahead. Like nothing is impossible. So if you have anyone who is staying in Australia or who can guide you through this pathway, or who can help you along with for visa and for other purposes, please go ahead with this option. If not, I would suggest you to go for plab. It is relatively cheaper. It is about like $300 pounds for first examination and about 1,000 for part 2. Whereas this one is damn expensive, like 3,530 for second one and 2,720 for one. So that way plab is good. If not, then AMC. IMGs are needed in Australia, but they're at the bottom of the list of priority. Like they'll definitely prefer their own local graduates. So this is it for this video. If you have any comments, suggestions, anything, drop them down in the comment section below. Please watch, share and subscribe. Thank you for watching.